Well, as we just saw in that video, some warning signs of a heart attack or heart disease are obvious, while others are obviously not. Joining us now, Dr. Smalley, a cardiologist with Regents. Now, doctor, that was a humorous video about some of the warning signs and sometimes how women can ignore them. What maybe are the major ones that women don't know that they're having a heart attack?
So that's a good point, is what symptoms should one watch for to know that she is maybe having a heart attack. And the first fact that people may not know is that women very often may have no symptoms whatsoever before their heart attack.
Really?
So up to 60% may have no symptoms, which is one of the reasons it's such a serious thing. The symptoms that you need to watch for are different between men and women. Men will typically describe a crushing or a pressure-like pain in the center of the chest. They may have some radiation down the arm. It's very different. Women may feel more like they have jaw, neck, or back discomfort. They may also have shortness of breath alone, or they may just feel fatigued or exhausted. So the symptoms can be quite different than what you normally see in a man. And it can also be very subtle. So whereas women are more attuned to their body's symptoms, it's hard to figure out those subtle signs. Sometimes it can be indicating that there's a severe heart problem.
And one thing that's a concern, the data shows that when women have a heart attack, they're more likely to die than a man who has a heart attack. And why is that? Because they want to put them off for 10 minutes like in that video, or they're in denial? Why is that?
The late presentation is a good point. That may be part of it. It's also that they tend to present when the disease may be more advanced. Men tend to come in earlier where there's less severe blockage. Women tend to have more diffuse disease. So that's one issue, is just coming in later. Others, the disease may be more advanced. And then just interpreting the symptoms is very difficult in the first place. So the treatment may be delayed. And
they showed the child giving the mother the phone with all the symptoms. Women should really get this information for themselves and to know their bodies and to know what's not the same.
That's correct. And even if you don't have heart disease, you may be able to pass along some of the information that people are learning to your loved ones, to older members of your family. Women do tend to get it about 10 years later, so get the word out and spread that.
So bottom line, get it checked out. And make
bottom
sure
line, stay tuned in, get it checked out.
Thank you very much. Dr. Smalley from Regents, thank you very much for being here. Heidi, we're going to send it back to you right now.
Straight ahead on this Fox 9 Heart Smart special. So what can we all do